Hello, everyone. Welcome to another dentistry business webinar. Today, thank you everyone for joining. So we are live on Facebook, LinkedIn, and YouTube as well. So the link is there in the chat, so you can take the link and paste it in your Facebook so your friends, colleagues, family members can watch it live as well. So we have a chat section. Feel free to post your questions in the chat section there. For anyone watching on LinkedIn, YouTube, or Facebook, feel free to post the chat there as well. So great. Thanks, and let's get started. So one of the benefits, if you can call it that, of the pandemic is that the Ministry of Labor and Public Health has paused inspection for dental offices. But once the pandemic subsides or they have it under control, you can expect that for them to start the inspections again. So it could be very stressful, risky, difficult time for dental offices on top of what you have to do now. So it's very important to know how to prepare for an inspection, what to expect during the inspection, and also what to do if you have some infractions. And that's what the webinar here today is about. Sandie Baillargeon, President of Dental Office Consulting Services, will be walking you through the different stages and how you can prepare, and an update on the 2020 inspections and protocols. Before we start, I just want to welcome everyone and introduce everyone to Dentistry Business. Dentistry Business is an educational platform for the dental industry. We look to have the top speakers to come here, educate, inform, and update everyone on the latest trends, best practices, and procedures to help you grow your dental practice. And just a quick info about me. I am the CEO of Dentistfine, a result-driven dental marketing platform. We provide marketing services as well as our technology to help dental offices attract new patients. Using our technology usually increases patient booking by 40% up to 300%. And I also teach a course at the University of Toronto, the Dental Marketing Social Media Fundamentals course. And our featured speaker here today is Sandie Baillargeon of the Dental Office Consulting Services. She is a leading authority on how to increase the effectiveness of dental business systems. She is the author of 2 textbooks, Dental Office Administration and the Canadian Dental Office Administrator, published by Nelson Canada. Sandie is the owner and operator of Dental Office Consulting Services, which specializes in dental business planning, staff development, consulting, and continuing education seminars. Her signature courses include Dental Practice Manager and Dental Treatment Coordinator. So welcome, Sandie.
Thank you so much, Sharky. That's great. So hello, everyone, and welcome to the next seminar. This webinar tonight is intended to help prepare you for the eventuality of when Ministry of Labor and Public Health inspections should begin again. Because they, as Sharky mentioned, they are on hold at the moment. However, once the pandemic subsides, they will be conducted once again to make sure that everyone is following all of the COVID standards, and as well as all of the other standards that are currently in place and have been for some time. So when the crisis subsides, of course, the Public Health and Ministry of Labor inspectors will be visiting your offices, most likely, to ensure that proper procedures are in place and to protect the public as well as to protect your dental team as well. Once again, I apologize for the telephone in the background. It always happens when I'm doing a webinar. What we'll learn tonight, this evening, is who the inspectors are and why they would be coming to your office in the first place, what to expect if an inspector arrives at your office, also some steps to take to be prepared for the inspection, and what happens if an inspector happens to find an infraction. So that way you're prepared, you'll be relaxed, you won't have to worry about anything, because you'll know that you have everything all set. So who will be coming to inspect your office? One, the Public Health Department and the Ministry of Labor. So the Public Health Department will be looking, of course, for compliance with COVID protocols and to ensure that your infection prevention and control procedures are up to date and in place, of course, and that they're being followed, as well as contact tracing. Now, it's very easy to do contact tracing, or it's easier than in most industries to do contact tracing in dental offices because of the fact you have access to your schedule, you know what staff have been in, and so it's much easier to keep track in a dental office than it is in other areas. The Ministry of Labor will be looking certainly, once again, for compliance with COVID protocols, but also for compliance with the occupational health and safety standards. I'll be talking a little bit tonight, quite a bit tonight, about what's involved in being compliant with the Occupational Health and Safety Act, and I'll guide you through. It's quite extensive, and also compliance with the Employment Standards Act. That's extremely important because there's been some disruption in their jobs during the COVID. Of course, you've had to can have temporary layoffs in most cases, and in some cases, some people aren't getting their jobs back. So we're going to talk about all of this tonight. So public health, when they come to your office, they're going to look, as I mentioned, to make sure that you are following the proper protocols as far as COVID goes. So most of you will have the sneeze barriers up at the front desk, and do social distancing and distancing your patient appointments and that type of thing. So they'll be looking to make sure that you are following that, as well as the current infection prevention and control procedures. So IPAC, that they're in place, they're current, and that they're being followed. It's the responsibility of the practice owner to ensure that your team is trained in infection control procedures, make sure that your supplies and equipment are up to date and monitored, and that you have an infection control officer in place. So it's also very important to maintain an IPAC manual, that you have a current IPAC manual in your practice, and that you have annual IPAC training refreshers. So that, yeah, as you know, in the past couple of years, IPAC has been changing. There have been changes. There have not been any changes that I'm aware of since COVID has started. So as long as you're following the most current IPAC procedures, that's really the key. And monitor and review your policies and procedures, especially if you're bringing on new staff members. It's very important that they follow and they are aware of your IPAC procedures. And also to provide site-specific training and review this at least annually. So when I say site-specific training, that means if you have multiple offices, to ensure that IPAC procedures are being followed properly at either office or any of your offices. So the Infection Prevention and Control Policy and Procedure Manual must be created, and it has to be maintained and current. Same with your occupational health and safety, and we'll talk about that in just a few moments. So of course, the pre-screening procedures need to be taking place at your office. So pre-screening by telephone, when you're calling to confirm appointments or schedule appointments with patients, you ask the pre-screening questions. Then also let the patient know that they'll be asked those same questions when they come into the office. Their temperature will likely be taken, and make sure that all of the answers to those questions are recorded in your files. That's really important. So questions such as, do you have current fever? Do you have a cough? Do you have any difficulty breathing? In the last 14 days, have you traveled outside of Canada? In the last 14 days, have you come into contact with someone who's suspected or confirmed who has COVID? In the last 14 days, have you come in contact with someone who's been unwell in any capacity? If they answer yes to any of the above, ask that they stay home and contact their primary healthcare physician or call telehealth. Before your employees return to work, most of them are back to work, but some are not yet. It's important to have a fitness to work policy in place. So that is part of your occupational health and safety procedures. So it's important that that you have this in place, and it also helps you to be compliant with the Employment Standards Act as well. So staff needs to be screened, temperatures need to be taken and recorded. This policy will provide you with procedures when bringing back staff, not just now, but in the future, for future reference, once the COVID has subsided. So refer also to your regulatory body often and the public health department for any further guidance on back to work protocols. It's a good idea to check these sites regularly because things change. As you know, they've changed frequently over the past few months. Now, the bottom line is that even with the strictest screening procedures in place, it's possible that a non-symptomatic patient or healthcare worker who has attended the dental office for services may test positive after the fact, after they've been at your office. And that's just the nature of this virus. It is asymptomatic for a number of weeks before the patient, and some patients don't even feel symptoms, so it's very difficult to contain. So when you become aware of a patient's positive test for COVID or onset of symptoms, you must contact all patients and staff who were in the clinic 48 hours leading up to the patient's visit to the office. So that's why your appointment schedule is going to be very important, and also your staff schedule will be very important as well to maintain and to be able to contact trace quite easily. The Ministry of Labour will come in and do compliance inspections for the Occupational Health and Safety Act, as well as the Employment Standards Act. The Occupational Health and Safety Act is very important right now because, well, it's always important. You have to have a health and safety policy and procedure in your office. So inspections to cover safe workplaces and to ensure that employers are abiding by the Employment Standards Act. These issues are not going away. They, although they have been suspended temporarily, they will be coming back. I know in Ontario, I don't know if you have non-Ontario people on the line, but in Ontario, certainly the Premier is stating over and over again that these inspections will be resuming very soon. So not to get too concerned or worried, because the chances are that you are likely following really good standards, but I'm just going to guide you through some guidelines this evening. So as far as the Occupational Health and Safety Act goes, employers are legally responsible for providing a safe, healthy and safe workplace, regardless of the number of workers that are employed. And the Occupational Health and Safety Act, it needs to be implemented in every office, and all team members need to be trained on your health and safety program. The program is not a static document. That's very important to know. It is a series of continuous activities, and it must be kept up to date. So the important thing is that we provide occupational health and safety training, as well as a binder and USB key. But it's a complete program that needs to be maintained and monitored and worked on continuously, and we can guide you through that as well. So as far as the occupational health and safety awareness training, the primary responsibilities are for your staff to get on board, to understand what their roles are, their duties, and their rights are under the Occupational Health and Safety Act. To get involved, in other words, to work together. It's not just to have a binder or a document in your office. It's important that your staff, your team all work together to participate, and also to follow the safe standards, to be a role model as well. And also they have the right to know, so they have the right to know what hazards exist in your practice and what protections you have in place to protect your employees. And also to get more help, if employees have the right to refuse work if they deem it unsafe, And the key word in any occupational health and safety program is if the employer has taken reasonable steps to ensure that the employee is safe in the workplace. That's a key word, because accidents may happen, but as long as the employer has taken reasonable steps to prevent them from happening, then the Ministry of Labor will look on that as well, look on that kindly. So the Ministry of Labor can enter your workplace at any time without notice or warrant. They must show current identification, because you don't want just anyone walking around your office and checking things out. You want to make sure that it is the proper person. They may ask for the worker representative to accompany him or her on a tour of the workplace. So you need to have an elected health and safety representative, depending on the number of employees that you have at your practice. So if you have less than 20 employees, then you need one occupational health and safety representative, and that representative has to be an elected worker. It cannot be a management person, and we'll talk about that in just a moment as well. If an inspector finds any infractions, he or she may issue an order, and that order would consist of telling you that you need to get it fixed, basically. So depending on the nature of the infraction and jurisdiction, the infractions may be subject to fines that carry the risk of strict liability charges and penalties as well. If convicted of an offense, an individual can be fined up to $25,000 per offense, and or imprisonment up to 12 months. I know that sounds really drastic and not too pleasant, but those would be for very serious, egregious offenses, of course. The maximum fine for corporations can be up to $500,000. So the Provincial Offences Act provides the Ministry of Labor inspectors the ability to issue tickets within the workplaces for certain offenses under the Occupational Health and Safety Act and the Health and Safety Awareness Training Regulation. So the tickets can carry up to $550 per offense as far as fines go. And some of the examples of what you might be issued a ticket for are as follows: the employer failing to cause the workers to select at least one health and safety rep. So that's very important. If you don't have a health and safety rep who's elected by the other workers, then that's one of the first things that needs to be done. Employer failing to cause joint health and safety committee to be established. Now that would be for offices who have over 20 employees. And the thing to keep in mind too when you are implementing your joint health and safety committee is if you have multiple practices and it's one employer who has, let's say, 3 or 4 practices, if you have more than 20 employees, you need to have a joint health and safety committee, and they need to meet regularly and also to record the minutes. And I'll talk about how that is put together. An employer failing to prepare a written occupational health and safety policy can be issued a ticket as well. Employer failing to pre-develop occupational health and safety program. Employer failing to maintain their occupational health and safety program. The employer failing to prepare the workplace or workplace violence policy. The employer failing to prepare workplace harassment policy, and an employer failing to develop workplace violence programs. So there's all kinds of reasons, and I just touched on some of them, and some of the more important ones as well. Now, the important thing is that the office establishes an internal responsibility system. This is foundational to the Occupational Health and Safety Act. The Occupational Health and Safety Act creates a set of interlocking duties, obligations, and rights. Everyone in the workplace shares a responsibility for health and safety according to their authority and their ability. This is built on the self-reliance of all in the workplace. So not just one person is in charge of occupational health and safety, it's everyone in the workplace is expected to be safe and to work under the guidelines. So for example, if you have a policy in place that requires your staff members, your team members to wear PPE when they're sterilizing equipment or sterilizing the instruments, then they must wear it. I know I've been in offices where there's been a refusal to wear safety glasses, for example, in the sterile bay, and if you have your policy in place, the employee must wear it. That's really important, and it's to protect them, and that's really the key thing that they need to understand. So who is the employer? The employer is a person who employs one or more workers or who contracts the services of one or more workers. This includes a contractor or subcontractor who undertakes an owner to perform work or supply services. The duties of the employer are to prepare and review written health and safety policy and to develop and maintain a program to implement that policy. It's very important to elect a health and safety representative or a joint health and safety committee, depending on the size of your hours. And also, it's the important point is to take every reasonable precaution in order to protect your workers. So if you have less than, if you have 19 employees, 0 to 19 employees, I'm sorry, 5 to 19 employees, then you need to have an elected health and safety representative who cannot be management. If you have more than 20 employees, 20 or more employees, then you have to have a joint health and safety committee, once again elected, but one, it can be from management and the other needs to be a worker. So the duties of the supervisor are to tell workers about hazards and dangers in the workplace and to show them how to work more safely. Also to make sure that they follow the law and the workplace health and safety policies and procedures that you have in your office. Make sure workers wear and use the right protective equipment, as we've heard a lot about lately, of course, and do everything reasonable to keep workers from getting hurt or getting sick on the job. The duties of the worker are to follow the law and the workplace health and safety policies and procedures that you have in place. Also, always to wear or use protective equipment that the employer requires. So if you require PPE to be worn in the sterile bay, then that's absolutely mandatory. Excuse me. Also to work and act in a way that won't hurt them or any other worker. And report any hazard that they find in the workplace and report it to their supervisor or to the health and safety rep. So if you don't have an office manager in your practice, then the worker, if they think that something is unsafe, then they need to report it to their health and safety rep. The workers have 3 basic rights under the Occupational Health and Safety Act, and the first is the right to know. So they have the right to know about any potential hazards that may be present in the workplace, and this is covered under your WHMIS policy. So your WHMIS policy is, of course, Workplace Hazardous Materials Information System, and it's also replaced by the Global Harmonized System, which basically is just the symbols are easy to follow in any language or any country. To participate, the workers have the right to participate in their health and safety by routinely following safe work practices or identifying and reporting any hazards to their supervisor or employer. And also they have the right to refuse to do particular work if they believe that the procedure is likely to endanger themselves or to endanger another employee. So those are the key factors. It's important to have a violence and harassment prevention program in place. And also you'll notice this poster. This is available on Public Services Health and Safety Association, and it needs to be posted in your staff room or in a place that's visible to your employees. It's absolutely mandatory to have a workplace violence and harassment program in place. The health and safety rep or joint health and safety committee must be involved in completing the risk assessment process. So the risk assessment needs to be completed by the health and safety representative. This assessment, I've just put, it's in our health and safety binder. We have all of this information prepared already for you and available to you if you would like to contact us at Docs. This needs to be reviewed by the health and safety rep at least annually. That's critically important in order to make the necessary changes. On the top of our policies, we have an area where you can insert a date, and that date needs to be reviewed and put in your binder annually. If the inspectors come to your office, they're going to want to see your health and safety policy. They're going to want to see your manuals, and they'll be looking for the currency of them as well. It's very important, of course, to have an eye wash station. Now, most offices have eye wash stations now, but the eye wash stations, it's very important to have it in a central location where it's not closed in by a door. So I've been in offices where they had the eye wash station in the kitchen, for example. And if the door closes to the kitchen, then it can't be there. It has to be in a central location. The patient has to be able to reach it within 10 to 15 seconds. And remember that the patient or the worker needs to reach it within 10 to 15 seconds. So it needs to be in a central location because remember, if they've had an eye injury, they're blinded when they're going to the eye wash station. The eye wash station needs to have a thermal regulator on it so the water needs to be tepid. Not hot or cold. It needs to be tepid, room temperature, and it needs to be accessible, and it needs to be able to run for a solid 15 minutes. So it's important that it's plumbed in. I know that some offices will have, or some places of employment have eye wash the bottles, and they're not appropriate because of the fact that you cannot wash the eyes continuously for 15 minutes until first responders arrive. So that's a key thing. And you notice that there's like a kick valve there. The health and safety rep should, on a monthly basis, check this eye wash station, make sure that it is running clear and that it's running at a tepid temperature as well. You need to have an emergency response plan and procedures in place, and they need to be practiced and followed. It's very important. You think of this as drills that you did in school. You know, fire drills that offices and schools still have in place now. So do it once a month. You can do this as part of your team meeting, and just every once in a while do it. Have your health and safety once a month, but do your emergency response procedures, once a year or twice a year even. So the team needs to know which exit to take and how to safely and calmly evacuate patients and other team members. There needs to be a pre-established meeting area, for example, in a parking lot or near the nearest corner. So, and one person needs to be available to direct the first responders while another person waits until the evacuation is complete and ensures that no one is left in the building. So a couple of things I just wanted to mention. If you have, let's say you have a parent in the waiting room or the reception area and you have a child in the chair, most offices will have two ways to exit the office. And so it's very important that the receptionist at the front desk knows how to keep that parent or grandparent calm at the front desk and let them know that their child is safely being evacuated and that you meet up in the parking lot. So that's a very important thing to know, and to know what to do. It's also very important to, if you have new staff members coming in, or if you have temporary staff members coming in, take them through an orientation process of health and safety, occupational health and safety, and record it on a checklist that you have taken them through that. Because if an emergency occurs and you have a temporary staff member that's in your office and they don't know what to do, it can be troublesome. Always have your fire extinguishers should be mounted and very easy to locate and accessible. They should be checked monthly by your health and safety rep, and you're required to make sure that you have the extinguisher serviced by a qualified firm that has the tools and materials available to service the unit properly. And also, as I mentioned, fire drills should be part of your evacuation plan. But on a monthly basis, I just want to point out what your health and safety reps should be looking for. They should be looking at the fire extinguisher and looking for this, looking for the gauge there. There's a little needle in between that green zone. That needle needs to be within the green zone, otherwise it's either lost its charge or it needs to be serviced. And the other thing too is the pin that needs to be intact and in place. Otherwise, you don't know if it's been used or if it has the proper integrity. And there's also a cardboard, little piece of cardboard that's attached to the fire extinguisher. That's what the health and safety rep needs to sign and or just initial and put the date that fire extinguisher was checked. So it's important that they should be mounted on the walls and easily accessible. All of your exits need to have clear signs that are well lit. I don't know if you can see on the bottom of this sign that I have here, there is a button on the bottom, and on a monthly basis, the health and safety rep should go and press that button. And what you're not seeing in this picture that I've shown is above that should be 2 emergency lights. So the health and safety rep will take a broom or a stick or something and just touch that button to make sure that the emergency lights in fact light up. So that's an important thing. It's important to have floor plans available as well. You can, if you don't have the floor plans from when you originally opened your office, that's fine. You can simply draw a floor plan. This is important to have in areas where you can where the patients can see them. Sorry. So it's just much like a hotel. When you go stay in a hotel, on the back of the door, there's always the fire route, so it tells you how to escape if need be. On your floor plan, it's important to include anything that could be possibly explosive, like oxygen tanks, of course, and things like that. The reason being is when the first responders, they need to know if there are any explosives in the area. And you may not think that something could be explosive, but it could be a danger to the first responders. So that's important. So the important thing is that you have an evacuation plan in place and that you practice it. So that's a key thing. Now, just to give you an idea of what the contents of the health and safety program that we have here at Docs, these are all of the things that are in the binder, health and safety principles. That's your overarching health and safety policy. Any accident injury reporting, the terms of reference for your health and safety rep or your joint health and safety committee, anti-violence and anti-harassment policy, and that needs to be posted and signed by everyone. Any hazards, so that's and work refusals, the process, it will take you through that. Business interruptions, and I just want to link business interruptions and pandemic planning. We've had this as part of the occupational health and safety policies and procedures for dental offices since as far back as 2012. So we've had an idea that it was coming, and but that pandemic plan will guide you through all of the processes, like I talked about, the fitness to work policy and procedure, and all that kind of thing. It's a very extensive part of the actual manual itself. Our WMIS policy, of course, your WMIS policy, contact control and monitoring during a pandemic is extremely important to know what to do. Safe return to work, and how to deal with sedation and drugs. And emergency response procedures, of course, first aid, health and safety orientation. There's also a checklist in there for new employees. An office policy on disabilities. Now, a key thing to know on this is that all employers across Canada by 2025, certainly in Ontario by 2025, and it is going across Canada as well, and that is that you need to be fully accessible for employees. Patients, and that means being accessible to patients who have disabilities like hearing loss, vision loss, things like that, and physical disabilities, people who have service animals and that kind of thing. So that covers all of that in there as well. X-ray safety, of course, there's a policy in there for that. Exposure to blood from there's information from the Center for Disease Control. Infection policy procedures, but we do that separately now, even though there is an infection control section in the health and safety binder. We do that separately, of course, because things have changed in the past couple of years, and we want to make sure that we're most current in that regard. How to do monthly inspections, and so on and so forth. So there's lots of other forms in there. It's jam-packed, but we also provide you with the USB key. So you can update your policies every year, and if there are any changes, they can be updated very quickly. The practice needs to also have a radiation binder that includes the name of your radiation protection officer, and this is always the dentist. Approval of all X-ray units from the Ministry of Health and Long-Term Care. Ownership registration of all X-ray units. The daily quality X-ray testing log report, and this needs to be kept for a period of 2 years as well, for digital and film-based. Annual testing of any X-ray units. The reports for those need to be kept up to 6 years. And proof of HARP qualification for anyone who's taking radiographs. So that's, of course, Healing Arts Radiation Protection. Health and safety workplace training will be part of the orientation process for new employees. Ongoing training and updating and signing off of manuals should occur on an annual basis. Team meetings should include a continuous health and safety component. Now, what I suggest, because you've seen how extensive this system is and this program is, what I suggest to health and safety reps is at every staff meeting, and we highly recommend having staff meetings every month, that there needs to be a health and safety component, and in each one, roll out another policy. You know, make sure that everyone understands what that policy is, and you know, sign off on it, have it initialed and dated, that the date that it's been implemented, and that will keep you up to date and not be too overwhelming for the health and safety rep. Your health and safety program is a continuous process, as I mentioned earlier. It needs to be reviewed and updated at least annually. So using this approach, assess the risks and hazards that exist in your practice, plan on ways to reduce the risks, implement policies and procedures to prevent accidents and injuries, and to know what to do if an event occurs, and also to evaluate the effectiveness of your implementation. It's not always perfect, but at least it's a start, and you're taking reasonable measures to make sure that your staff are safe and protected. The next thing that the Ministry of Labor would be looking at as well is the the Employment Standards Act, to make sure that all employers follow the Employment Standards Act. So what is it? It is a law that establishes the minimum employer obligations and employee rights, and with respect to rates of pay, excuse me, hours of work, and overtime, vacations, public holidays, leaves of absence, and much more. Every province has similar laws in place to protect their employees. And the Employment Standards Act applies to all employees and employers in your province. The Employment Standards Act is enforced by employment standards officers who visit businesses to help educate employers on their obligations and to ensure that employees' rights are being protected. The employment standards officers will give you some notes. Excuse me for 1 second. Sorry about that. Employment standards officers proactively will visit your businesses even if no complaint has been filed by an employee. And these officers will help you to correct areas where your business is not complying with the Employment Standards Act. Now, a couple things to note here is that they're not coming necessarily to find things that you're doing wrong. That's a key thing to remember. They're there to help you, to make sure that you are following everything. The other thing that you need to know with the Employment Standards Act is if an inspector comes to your office, they generally will give you notice. They'll give you written notice. And it's nothing to be too concerned about because you are following the proper employment standards anyway. But just make sure that you have all of your records ready and that you show them that you're following all the standards. And they're also there to help you follow the proper Employment Standards Act, so you don't necessarily run into problems at a later time. So don't be too terribly concerned if this should happen. Excuse me. Excuse me. I also had a client who received that letter from the Ministry of Labor saying that they were doing an inspection. And he contacted me and he said, you know, did somebody call them and complain to the Ministry of Labor, which your employees, by the way, have every right to do so if they wish to. But the fact is that they do random inspections. They inspect all employers. They do give you advance notice when they're doing this, and the thing is that something you need to remember too is when they arrive at your office, they already know the answers. So they've already checked with the CRA records, and they know exactly what your employees are being paid. The reason I'm mentioning that is because there's no point in changing anything, because they already know. Not that you would, but that's an important thing to remember. So they're going to review your records, and they'll speak to you, and they may speak to your employees as well. If there are issues with non-compliance, they'll discuss it with you, the employer, and depending on the nature of the violation, they may provide you with an opportunity to correct it before taking enforcement action. So, for example, if an employee's worked more than 44 hours in a given work week, and they were not provided with overtime pay, for example, then they'll give you an opportunity to correct that by paying the employee what they're owed. The prosecutions each year, hundreds of prosecutions are brought against employers for violating the Employment Standards Act. So some prosecutions have resulted in fines and or court orders, tens of thousands of dollars or more, where the employer is an individual rather than a corporation. He or she can also go to jail. Once again, these are very egregious errors or blatant violations of the law. So it wouldn't be for just a minor thing by not paying somebody overtime pay when they were due. So it would have to be something much more serious. The role of the employment standards officers are to conduct inspections and investigations. They will travel all over the province to inspect workplaces, and they often do this in blitzes. So they may target, for example, the healthcare sector one year, and it could be construction sites another year, but all employers are expected to be in compliance. These inspections will make sure that you are complying with the responsibilities under the Provincial Employment Standards Act. The ESA inspections, the officers will focus on things like posting the employment standards poster in the workplace. That's really important, so employees know that they have the right to call the Ministry of Labor if they so choose. And something else I just want to point out too is the Ministry of Labor consists of reasonable people. They know if you just have a disgruntled employee who just feels like calling and complaining for no reason, they can see through a lot of that. They understand that there are employee disputes. They're looking for something that is more serious, that is a blatant violation of the Employment Standards Act. They will look for timely and accurate wage statements with no unauthorized deductions. So, for example, if your employee left your practice, either they quit or they were terminated, and let's say you did some dental work for them and they owed money on their account, you cannot take that off of their final pay. That they have to be paid for all of the hours that they worked. If they still owe you money, then work out a payment plan or payment method of payment after they have left, but you cannot take anything unauthorized off of their pay. They need to be paid for the hours they work. Have accurate record keeping. Also note when inspectors come to your office, they already know, as I mentioned earlier, what's been submitted to CRA, so they already have the employees' tax returns and the information in front of them. They really just want to make sure that you're following all of the standards of the ESA. So they're looking things for proper hours of work and eating periods. That's a key point, because the eating periods, all employees cannot work over 5 consecutive hours without having a half-hour unpaid lunch period. So that's extremely important, because in dental offices, sometimes employees will say, well, I want to work through and just leave early. That's not the case. They can't work more than 5 consecutive hours. And if it shows up in your records, then that could be a problem for you as well. Having accurate overtime pay, which I've already mentioned. Adherence to the minimum wage standards is extremely important. You can't pay below minimum wage. Ensuring that employees are paid for the statutory holidays, and that you're following vacation pay standards. So that's up to 5 years. The employees get 4% of their wages, which works out to 2 weeks if it's a full-time employee. And after 5 years of employment, they are now entitled to 6 weeks, which, 3 weeks, which is 6%. The employers will typically give you 10 days written notice that the inspection will take place. So this gives you time to make sure that the records are available for them. It also gives the Ministry of Labour time to do their preparation. As I said, they will check with CRA, make sure that they have done their homework before they come in. They will check the legal name of your business, as well as whether it's still active, and they will look at any claims and inspections history as well. They will also check to see if your workplace is unionized, but they typically do not visit unionized workplaces because of the fact that that's what the union's job is, really, to protect the workers. They have their own dispute process as well, and resolution process that they follow. So how are workplaces selected? They can be selected in a variety of different ways. One is third-party information, or local intelligence, or just random selection. As part of a sector-specific enforcement blitz. So there are various different ways. It doesn't mean a complaint has gone into the Ministry of Labour. It could be one of any of those areas. In some cases, they may also re-inspect the workplace to ensure that past violations have been corrected. Now, to give you an example of something where it ties in with health and safety is sometimes if there are too many EI claims going in. So I'll just give an example of one specific that I know of. There were two hygienists in an office that both went off at the same time on employment insurance and medical leave, and they were both suffering from carpal tunnel syndrome. So it could have been a coincidence, but it could have been that they were working incorrectly, or they don't know. But anyway, what it did was it triggered a ministry inspection at their office. So what to expect if they come in to inspect for employment standards is, once again, the person who's the inspector must show their identification, and they will likely meet with the employer first or the authorized representative. So if you have an office manager, but technically the dentist is the employer, so the inspector will probably want to meet with both. They will review a variety of documents that relate to the Employment Standards Act, and they'll begin an interview to determine compliance. During the inspection, the Employment Standards Officer will take a look at a number of records, which may include, of course, your schedules, your timesheets, your payroll ledgers, and wage statements. The notice that they send out to employers also indicates the importance about the employment standards poster. That poster is extremely important to have posted in your staff room, or as long as it's visible to your employees. The inspector will also interview employees that they select at random as well. If the inspector has reason to believe that there is not going to be adequate privacy to protect the interview of the employee, he or she will make that known to you and let you know that they require a place that is comfortable and is isolated from the rest of the workforce in the work environment. The documents that are needed during the inspection, some documents are going to be required from the employer to prove the various standards are being complied with. The inspector will then use the documents provided by the employer to perform a test audit. The test audit involves the selection and review of payroll and other records. They randomly select employees to determine that at least the minimum standards are being met. When the test audit is finished, if they find that there is compliance with standards that were inspected, they will then issue an inspection report which outlines the steps that they took and the findings that they've made, and then the file is closed. So it's a fairly easy process. As long as you are maintaining good records, employee records, then you won't have anything to worry about. If problems are discovered, if it's been found that the employer has contravened the Employment Standards Act, a full audit or a self-audit may be conducted for a set period of time. If it's determined that the employer has contravened the Employment Standards Act, they may take enforcement actions such as issuing a ticket, issuing a notice of contravention, or in some cases, recommending Part 3 prosecution under the Provincial Offences Act. But again, that would be rare and it would be unusual, especially in dental offices. All the dental offices that I know of, they follow the Employment Standards Act. If problems are discovered, when the audit's completed, the employer will be asked to voluntarily comply and correct any of the issues that were discovered during the inspection. If wages are outstanding to the employee, they will ask to pay their wages. And if the employer does not comply voluntarily, they will issue an order to pay the amounts that are outstanding. When the inspection is completed, the officer will provide the employee with, the employer with an inspection report, which is required to be posted. The employer is asked to complete a notification of compliance indicating the dates on which the compliance has been achieved. And when the notification of compliance form is returned to the officer, the inspection is closed. However, the employer can be identified for a re-inspection at a later date just to still ensure that compliance is taking place. Along with the offer of employment, it's important to have an employee handbook in place. So your candidate or whoever is applying for a job should receive a copy of your employee handbook that outlines your office policies and procedures. This helps to prevent any misunderstandings that may occur. It clearly delineates any personnel policies within your office, and it also will assist you with being ESA compliant. So should you have employment contracts in place? And the simple answer is yes. Employment contracts will protect the employer and the employee. The Employment Standards Act is the minimum entitlement if you need to terminate, for example, 1 week for each year up to a maximum of 8 weeks. However, the common law may award 1 month per year if you do not have an employment contract in place, or for more, they may give 1 month or more for extenuating circumstances, for example, the age of the employee. Employment contracts will help to limit the liability of the doctor to the Employment Standards Act. Employment contracts should be drawn up by an employment lawyer, by the way. They should contain items such as a non-disclosure agreement, a non-solicitation agreement, reference to the employee policies manual and handbook. That's where you have a little bit more flexibility for changes in that. Any references, and it should have many references to the Employment Standards Act. So that will help to let the inspector know that you are following the Employment Standards Act. As I mentioned, employment contracts should be prepared by an employment lawyer to save you the trouble. I know that it's a little bit of an expense in the initial output, but it will save you a lot in the end. If you don't have a written contract with your employees, the employees are working under the common law of Canada. If you wish to terminate an employee, you're obliged to provide 1 month, as I mentioned earlier, for each year of service, and there could be more as well in terms of damages. The court will also take into consideration the employee's age and their ability to find work of equal value. So keeping your personnel files up to date is critically important. Include the person's resume, unless for when you initially hired them, or in some offices they prefer to use a job application form rather than an actual resume. Keep your payroll records up to date. Have performance agreements in place, and if you're using performance agreements, it's very important to do performance reviews every year, annually. That's extremely important because of the fact that if an employee, let's say you had to discipline or terminate an employee, and they've never had a performance review done, and so they could claim that they have no idea that they were doing anything incorrectly, and that could cause them to sue for wrongful dismissal. So it's important to have performance reviews done annually. Plus, your employees are looking for that. They're looking for feedback from their employers. So that's very, very important to maintain. Now, when you're conducting annual performance reviews, something to consider is that a lot of employees will think that their performance review means that they're automatically getting a raise. It's very important to make sure that you separate the employee performance review process from the salary adjustment process. So base salary increases on objective data such as did they meet or exceed their goals, and what is the profitability of the practice. The practice has to be making money in order to make salary adjustments as well. But here's the key thing: salary increases need to be based on merit of performance. If you provide a non-performing employee or a poorly performing employee with an increase for no specific reason, then that can run into difficulty as well. Because once again, if you had to terminate that employee, they could go to an employment lawyer and say, but I got a raise, so I must have been doing well. And I had no idea because they never did a performance review. I had no idea I was doing anything wrong. So just protect all of these measures protect yourself, protect the employer. Hiring private contractors, I know that there are some dentists that may do this, but be sure to know your rights and obligations. What the CRA will look at is, does an employer-employee relationship exist? And for example, does the private contractor rent space from you? Do they use your services? Do they use the patient coordinator to make their appointments? Do they set their own hours, or do you set their hours? Do they use your patient base? Who owns the patient's chart? Their instruments, they have to have their own instruments, their own chair, or rent the chair from you. And then what about the x-ray equipment? So there's so many variables that could tend to lean toward the fact that the Canada Revenue Agency will say, we believe that an employer-employee relationship exists here. And if that should happen, then the employer is responsible for paying the CRA for all of the deductions that should have been taken, plus a gigantic penalty. And I know that this has happened to several employers. And the fact is that a hygienist can't just come to you and tell you that they have opened their own business, that they're self-initiating, that here's my business registration, so I don't want you to take withholding deductions. So if they insist on it, say, okay, we need you to go to Canada Revenue Agency and have written documentation that releases us from taking this, and then we will consider it. But the bottom line is to be on the safe side for all dentists. Your employees should be employees. If you have somebody working as a private contractor, it's a big danger to you as the employer. Now, that's what I was just saying, is that he or she can provide you with a written ruling from CCRA, source deductions that allows you not to take deductions. A copy of their business registration is not enough. If you don't, you may be subject to submitting not only the deductions plus the employer's portion, but you'll also be responsible for the penalty, and the penalties are not small. They're very large. So what happens if an inspector finds an infraction in your office? Depending on the nature and seriousness of it, they may issue you an order. Typically, they will give you a length of time to make the correction, and that time is most often is 21 days, so 3 weeks. They may come back to your office, or they may simply call you to see if you have made the correction. You'll have the opportunity to indicate why you have not made the change. And for example, I use this example because a few years ago, the Occupational Health and Safety Act would require dental offices to have retractable safety needles in their office. So you would have to prove why you can't use a retractable needle in the mouth, which was kind of silly. But what I was advising offices to do at that time was just to have someone in place, and if an inspector comes in, then show them and explain to them why that cannot be used in the mouth. So, so that was that. And then I think they dropped that. And the worst case scenario is if no changes have been made, they might fine you if they've specifically issued an order and nothing has been changed. So in summary, we know that all dental professionals have always done their very best to protect the employees and their patients, and you always will. Don't be overly alarmed if inspectors arrive at your office. They're reasonable people, and their purpose is to help you maintain compliance. They're not out to get you or out to cause you any discomfort. It's important to have complete and current systems, of course, in human resources management, occupational health and safety, and infection prevention and control. And of course, if you require any assistance with any of these systems, docs can certainly help you with that. Okay, I guess we can open it up to questions.
Thank you very much, Sandie, for that. Very informative and a lot of great details right there. Yep, so everyone from the webinar on Big Marker on Facebook, YouTube, LinkedIn, just post the questions in the comment section and we'll aggregate them. So while we wait for people to enter the questions, we already have a few already, which is great. So feel free to add more, everyone. While we wait for more questions, so Sandie, so we play a little video at the beginning. I was kind of surprised when I saw the video. I didn't know that your company offer actual services. I thought it was just consultation to dental offices, but now it's a new service that you offer, right?
Yes, exactly. Thank you, Sharky. Yeah, what we're doing now is we've just launched a brand new product, and it's called the Virtual Dental Office Manager. And so basically, we take over all of the managing of the monthly production reports. We'll do the metrics, follow the metrics, and report back to the doctor on how well he or she is doing, and deal with any personnel issues. You know, help with the human resources system, and we pretty much do everything that we're doing as consultants, but from a distance. So you don't have somebody in your office. And the reason I launched this is because I found that when I'm in the offices, although I really want to spend time with the staff members, they're busy servicing your patients, and you're busy taking care of your patients. So we decided that we would put this together, and we can do things remotely. And actually, that's one of the benefits that came from this COVID environment, is the fact that I was still doing consulting remotely, and it worked out better than I originally expected. So I thought, well, this can work for all dental offices then, if it can work for my specific clients. So that's why we did this.
Perfect. That's great. So let's go ahead and take some questions.
Great.
Here, let's see here. One of the questions earlier was about what are the requirements for a dental practice owner with respect to providing PPE for its staff?
Well, I'm going to defer that question because that really needs to be covered by the RCDS and public health. And I know that the RCDS right now and the CDHO are differing in their opinions of what needs to be provided. So I would say to contact your regulatory body and ask what the requirements are. It's my understanding that there has to be a certain amount of air exchange in the operatories, and you know, N95s are very difficult to get. So if there's an aerosol generating procedure, of course, you know, they need N95s and gowns. And most of the dentists that I know are really following this very closely and checking with their regulatory bodies. So I don't mean to avoid the question. I just would prefer that to defer it to the regulatory bodies, because they're the ones that set the standards.
So the person mentioned that I think the practice was only providing gloves and asking them to bring everything else. Does that make sense?
The owner is asking the employees to bring their own PPE?
Yeah.
No, it doesn't make sense to me.
Okay, doesn't make sense to me too.
No, because it's the employer's responsibility to keep their employees safe. So that's what we just talked about with the Occupational Health and Safety Act. So if it means keeping the employees safe by having proper safety equipment in place, then so be it. That's the employer's responsibility, not the employee.
Okay. Yeah. So Pamela asks, what about public health inspections?
Okay, I'm not specific about what the question is, but public health, as you're probably aware, did inspections a couple of years ago, and they found that some of the offices were not following proper infection prevention and control procedures. So that's why at Docs we've spent a great deal of time and training and just following up with everything that the public health has been providing. We guide offices through the processes to make sure that they are current and up to date with everything. But the public health, if you have been following the most current standards, either issued by the RCDS or the RCDS or public health itself, then you'll be fine. There won't be any problem. So the public health inspectors can come into your office and find that you're doing everything properly, and then nothing will happen. But if things aren't being done properly, as you're probably aware, a couple of years ago they were closing down offices. So it's very important to make sure that you are following the current standards and making sure that everything is being done properly.
Okay. And from your experience working with dental practices, what are the common mistakes of dentists that might lead to an infraction?
For concerning employment standards, or I can tell you one common thing that I see very often is dental assistants, for example, will want to work through their lunch and leave early, or they get an emergency just before lunch, and of course the dental assistant goes without their lunch. That's a common thing that happens. So that's one thing. The other thing is overtime pay. If you have an employee, let's say you've got more than one practice, and you have an employee who's working 2 days a week at one office and 3 days a week at another office, but they have accumulated more than 44 hours. Just because they're working